So it's really exciting. We've got this new project. So do you want to explain who you are and what we've done?
Okay, thank you, Louise. My name's Radhika Vohra. I'm a GP in Surrey since 2005, and I've always had an interest in women's health and gone on to become an associate in menopause recently, and progressed on to have a look at how we actually counsel women and the important fundamental role that plays in how they go on with their treatment moving forwards. And generally, from a cultural point of view, my own background and in the past, I've seen women are very reluctant to seek help for menopause because it's a bit of a taboo subject. There's a bit of shame associated to it, but there's also a degree of relief that menstruation has stopped. And they see that as a natural endpoint, but they're not thinking about the long-term consequences. So it was really exciting to get this opportunity to be able to work with you on these videos and get that counselling material out there available.
So it's fantastic. So what you've done is you've translated some very short videos that I had recorded before, and you've translated them into Punjabi. So there's real time you talking over me, which is fantastic, isn't it? But I was very interested, actually, as a non-Punjabi speaking woman, that there are a lot of English words coming through. So for me, that means that there aren't proper words, are there?
No.
Words like menopause, ovary, hysterectomy, there aren't words for them in
no, they don't exist. And when I asked my aunt and my mum about, just to clarify, is there any words for that? And they went, no, it's down below. And everything was this compass term down below. And you can see where then the misunderstandings carry on and it becomes a bit of a Chinese whisper.
Absolutely. And the menopause isn't about down below. It's nothing to do, like you quite rightly say, our periods stop, but actually it's about not having hormones all over our body. And that means that we have this risk of heart disease, diabetes, and a lot of people have an increased risk, don't they, from ethnic minorities? Can you just explain why that is?
No, they totally do. I mean, first of all, they already carry a high risk of metabolic disease, diabetes and heart disease. And they also have a different lipid structure and distribution of fat in their body. And quite often they don't present with hot flushes like we would typically see in Western women, because they have many women will have a diet very rich in plant proteins. And so they're getting natural phytoestrogens. So they don't present with flushing as such, but due to the lower muscle mass, they will often present with body pains, dizziness, and non-specific symptoms and weight gain. And all of those can be quite difficult to manage by someone who isn't thinking about menopause, or also isn't able to convey the importance of that very well. So it poses a real challenge for women, so they can be representers again and again and trying to seek help, and eventually the door's shut and they will just put up with the symptoms. But the long-term risks for them will always sit there, and particularly with the metabolic risks to their heart and diabetes, they get caught in a vicious cycle and they miss out on that window of opportunity.
Absolutely, and it's so important. So it's really important that healthcare professionals are educated, because it's so rewarding to treat these women properly, and all menopausal women indeed. But also it's very important to educate women so they know that it could be related to hormones that they would never have thought about, to open up that conversation, not just to their healthcare professional, but to their friends, hopefully their relatives, so they don't feel alone, because it's very scary otherwise. Their bodies are changing, they're getting these symptoms, their pains, their body shape is changing because of their hormone levels, and they don't understand. So I really hope these videos are the start of something we can really build on to help so many more women.
I totally hope so too. I think one of the things that I hope the videos will assist in is compliance as well, because quite often women will start treatment and then, due to inadequate counselling at the beginning or understanding of what they're taking, they will stop it very quickly, and we know that's not helpful for them at all.
No, absolutely.
Gone through the roughest time and then stopped it. So I think that's something that I would hope that the videos will help: initiation, understanding, and we know knowledge is power. Once they've got that knowledge, they can then move on and take control and hopefully comply and carry on and get those long-term benefits.
Absolutely. So I'm very grateful for you spending your time doing this. So thank you ever so much.
Absolute pleasure. Thank you.